Hi, I'm Zara.
And I'm Faith.
And we would like you to
sit down with us
every Wednesday. On today's episode of Sit Down With Us, we have special guest. And you might have recognised her from one of our previous episodes. But on today's episode, we have the lovely Angela joining us again.
Thank you very much. Thank you very much for having me again.
And from the previous episode, we learned that my mum is a nurse. So today we're going to get a nurse's perception of the trials and tribulations of ability and disability and differences and how it is, I guess, in that hemisphere of the world, which I know little about. I'm one of those where hospitals kind of freak me out. I want to be in and out very quickly.
Yeah.
But even growing up with a mum as a nurse, you know, I'm just very intrigued.
And I feel like as people with differences and disabilities, we've always been on the other side of it.
Yeah.
So it's kind of nice to have like a face-to-face conversation with someone who is in that industry and just see it from their point of view as well. So first of all, we would like to know what actually made you want to become a nurse? Was there like a pivotal moment? What was it?
Okay, so I think I'd be about maybe 14, 15. I was heading that way anyway. I always had probably a bit of a caring element to
caring nature,
my personality, my nature anyway. And then my dad was gravely ill in a hospital setting. He passed away. I was only 16 at the time. But just that phase of leading up to it, I thought, do you know what? I want to do this. And that just cemented it for me. So obviously then went to college and did a care certificate. What was it called? It was called a BTEC back then. I don't even know where they do it now, but yeah. So I went to college, did a BTEC, and then after that, applied for nursing.
Haven't looked back since.
6 years later, 35 years later, still in nursing and still loving it. It's not really a job; it's a vocation. That's what I say.
I like that.
I love that. Yeah.
Mm-hmm.
Yeah,
that's really cool.
It's a job that you really. It's a job that you really have to do. No, it's not a job that you decide. I think the job kind of finds you.
Yeah, I like that.
That's really nice.
That's a really gorgeous take on it, actually.
Yeah. So, where has your job taken you, and where are you now?
Yeah, so initially I was at 17. I was back then we were called auxiliaries. We used to wear brown dresses. It was delightful. The healthcare
very cold in midlife.
Yes. Really old now.
Oh gosh, that's not what I meant, by the way.
Oh God. So I was a healthcare assistant in theatres. So just a lot running around like cleaning, organising stuff. So that was I really enjoyed that job as a 17-year-old as well. And then obviously went to do my training. Loved my training. Best laughs of my best 3 years of my life, I think, at the minute. Oh, apart from having children.
I was about to say.
Sorry.
Yes, excuse me. Is that right here?
Children.
Aside from that,
met some good friends and had some amazing times. And then obviously initially got a job on a medical ward, and then the ward closed. that was NHS cuts even back then.
Wow.
And then I went to work in theatres. I was a scrub nurse for nearly 2 years. It was passing hammers and chisels for a living, but that was good. Again, that was interesting. Good fun. Learned a lot.
Yeah.
And then one day I woke up. I thought, I miss the people because they were asleep by the time they come to me.
Yeah.
So I thought, I miss the interaction with the patients at that point. So I was like, no, let's have a rethink. And I ended up on a ward that was a specialised surgical ward, all brains and spines, and I've been there ever since. 30 odd years.
Hello.
And surviving.
Just
about surviving.
I think one big question that I've been curious from with meeting different people in the past few years is the process in a hospital when someone's gone from able-bodied to disabled. And the support that's there, because I actually have no idea what support is there. If I was ever in that sort of situation, I wouldn't know who to turn to or what would happen. So what is the process?
That is quite a good question, especially because we obviously deal with brains and spines, and I'm not. This is what I've done for years. I know there's a lot of support groups out there, but a lot of our patients, when they come in, they are quite that we come in. They obviously they've got issues, but they can be quite mobile. Full head of hair, because obviously some of it is brain surgery, so they're having some of the hair buzzed off, which is like the image for men and women can be an issue. But obviously the spinal issues, if they've got operations to the spine, some again make complete full recovery, but not every surgery is 100% guaranteed. Sometimes it can be symptom control. Depends what they come in for. There's a lot of issues. So any disability that they might acquire or be left with as a result of the illness that they come in with, it is dealt on an individual level. I think it depends how the patient. I think leading up to the surgery, they've been counselled and prepared for the surgery. Everything is explained, even in the consent process. So they've got a sign to consent for the operations or the procedures that they're having done, so that they're aware that these potential things, life-changing situations, can be happening for them. And I think the family, a big part of it is supporting the family as well.
I was going to ask about that, actually, how the family almost deals with that information. Not that they have to deal with it, but it's still a shock to them, with almost turning their life at 180, and just how they process and navigate through that as well.
100%, because obviously from being, because sometimes quite a few of our patients can be then confused, personality changes. So they're dealing with a lot on a daily basis, and it can change on a daily basis as well. Someone coming in with like head injury, a traumatic brain injury, we deal with headway as well. So there are other support groups and support services that they can tap into when leaving hospital, because we're quite acute, so they tend not to stay with us very long. They move on to rehab centres or rehabilitation route. So we deal with the acute surgical side of things, and then they move on. But dealing with those changes with them at that time, again, if the patient is confused, it's the family that need the support as well. And I do like working with the families as well, and trying to support them, trying to just give them that reassurance that it might not be permanent, but you don't always want to give them false hope either, because nobody knows. At the end of the day,
I think as well, when it's brain and spine, it's so sensitive. It can go either way.
It can, it's and it is quite life changing. Obviously, every disability and difference is life changing to an extent, but I feel like with that one, it's as personal experience. I mean, mine wasn't an injury or anything. I was kind of born with it, so I don't know any different. But I can imagine how one day being able to run to the shops, and the next being completely bedbound. And I often see on people on social media who've had injuries where part of their accident, or however they've ended up with an injury or a spinal disability, there's always the depression side of things, which I hadn't really thought about before listening to their stories, which I think, and I guess that's what kind of you come across as well with your patients. And I do wonder, is there a particular story or a particular patient that's kind of stuck to you, their story stuck with you, that you can share with us?
I think you always have those few patients that will always stick with you. It's like even from years ago, decades ago, I still remember the lady's name that I injected my first injection as a student nurse.
Wow.
Yeah.
That's quite special, actually.
At times like that, you are petrified, and you've got to say, I'm confident at this. I've practiced an oranges, you know. So to actually do it on a real person was like, so a lot of patients, I think sometimes you don't always embrace the patient, it's the whole family. Because you do get involved with the whole family, especially if it's something quite close to your heart, or you've literally, especially if you admit them and then you see them through virtually the whole journey, you get to, on a personal level, they do tug at the heartstrings quite often. It is very difficult to separate the two sometimes. You do go home worrying about your patients sometimes as well, which, again, I don't think I'd be a good nurse if I didn't do that. That's just part of the job, I feel, as well. You just can't always switch off, leave it at the door, and carry on with life.
That's what makes you a great nurse for all these years.
Well, I think that's why I'm still doing it as well, because you don't live and breathe the job, obviously, but I think you are obviously you've got your own life after, but you've always got them in your mind as well. I think there was a gentleman. I won't go into too much detail because, and obviously no names.
Yes.
But he was similar age to myself, and again he had life-changing injuries. Went on to rehab, but he needed every support services, and he had a lot of life events happen. Unfortunately, he was with us with a significant length of time. And he lost family members, and while he was in hospital, so it was very difficult for him with added pressures from outside. Those ripples for him, we helped him deal with them as well because we got to know him, his family. So it was like it was happening for us as well. So we really kind of went through everything with him.
That's so interesting.
And he's been to rehab. He's since been back in for other procedures and bits and bobs. And it's one of them like, hi, you're from down the corridor. And it's like it's just that face. It's like even though they might lose a bit of weight or have the shave or the haircut or whatever, it's like you never forget them.
Never forget a face.
Yeah.
So obviously from working in different areas at the hospital and you've experienced now as a nurse, what has changed over time, I guess, for the better within this realm of topic?
Primarily, I think general medical sciences and things and techniques, procedures have changed a lot. It's like some of our patients at one time, like years ago, would never have survived a journey to have like a brain procedure. We had to send to London at one time.
Wow.
They would never survive the journey, whereas now we do it locally. And so, again, if they did survive the journey, they might have had complications that nowadays things are hopefully caught earlier, so that those complications aren't left with long-standing problems. So I think catching problems early, early diagnosis, that I think that could be key as well at the minute.
Definitely.
So, and like early intervention. It could be a big thing. I'll say accessibility to facilities, which is not physically, which obviously is a big issue. But I think being able to access your GP and like tap into the services, I think that's been testing times as well. And I think since COVID, that has had an impact. And there's been funding cuts and things like that. But I think that's just the nature of the NHS. There'll always be that, but every job has its problems. So you just rub along and you carry on.
Roll through it.
Yeah. I think the way we nurse patients after, I think we get them up quicker. The patients take a bit more ownership of their recovery as well now. Whereas one time it was like, you stay in bed for a week, you've had this operation. Whereas now it's like, right, come on, get up. It's like, I've had an operation. Yeah, but the quicker that you can get you up and moving does down the line
improve the recovery.
Very much so. Yeah. But just technology and I'll be honest, the bane of my life, the bane of my job is the computer. I hate a computer. But it's kind of took over the job. I used to love sitting on a bed, chatting with a patient, cup of tea, let's have a natter. 3 o'clock in the morning. I had quite a few of those moments as well because I worked nights, bringing up the girls. I worked nights for 21, 22 years. So a lot of the therapy really and the counselling and the psychological side of things happened in the middle of the night, a chit chat. Want to be 10-15 minutes, but you put that patient at rest, put the mind at ease, and I think it's that side of the job I love, and I'd forfeit the computer any day, but I know things have to be done and it's got to be done, but I would always have a natter for just that is 10 minutes.
Yeah.
I'm always getting in trouble for talking at work.
It doesn't always have to be about diagnosis and serious stuff, does it?
No. And I think I think as well, no matter how serious things have got and how the pace, the pace of everything as well at work, you have to have the camaraderie and the giggles, the laughs and giggles.
The laughs and giggles. I love that.
Yeah. Sometimes it can be inappropriate moments, but I think it kind of makes the moment less inappropriate. because it's just the circle of life that you've got to be a bit more lighthearted with these days. I think it helps.
So now we've come to the myth part of our podcast. I guess what some people think is that nurses generally tend to be used to trauma/death. And we were just wondering what you thought about that as being an actual nurse.
Okay, so obviously we do deal with both trauma and death. I think every nurse will come across it in their career. As for trauma, I actually work on a surgical ward because I'm not very good with trauma, as my middle daughter will let you know. I was one of them, broke a finger, and it's like, oh no, come on. No.
That's it.
Fine.
Someone else's problem.
Yes. Let's go and see somebody else. But from no, I think because I work on a surgical ward, I can say more controlled, but not necessarily. So the trauma thing, I think you just deal with at the time, and you just you find your way to process these things, because it can be very traumatic. As for death, I think I can't say you get used to it. Every death, it's like you've got to keep it it's like an honour to be there, to nurse somebody at the end of their life. I think you're not only nursing that patient, you're nursing the relatives as well. You're being there for the relatives. Some people want you there, some don't. Again, it's the wishes of the patient and the family. And then I think immediately with the patient passes away, I think just giving the support to the family, giving them time, and going through the process with them, comforting them. I get a lot of comfort from that, especially if I've nursed this patient, and you do get quite close to them. And I think one of the things I find an honour is doing, we call it last offices, like just preparing the patient to move on to go to the mortuary before they carry on the journey. And I find that an honour. That's the last thing I can do as a nurse for that patient. So,
it's very lovely.
I can imagine something that you actually can't get used to, because every person's different as well. So yeah, that's
we busted that myth, didn't we?
So as you are, I would say, my mum and a nurse, how has being a mum impacted you as a nurse, or has it impacted you as a nurse?
Oh yeah, very much so. Obviously, firsthand, I have got patients at home.
It's all coming out now.
I think being what's the word I'm looking for? Empathic at home. I do empathise and sympathise. Yeah, but
I think it's because you see so much at work that when you come home and I cut my finger or something, it's just
empathy runs out.
Put a plaster on and you're fine.
Yeah.
And I think especially when it's a cold or a cough, it's like, oh, you're fine, just paracetamol, Calpol, go to bed, sleep it off, But I mean,
I have been quite brutal with the girls growing up. They're like,
it's built resilience, though. It's built resilience.
That's good.
No, it's good.
I know it's the mum in me, but it's the nurse in me as well.
I feel like a lot of mothers and nurses are potentially the same, with a few aunties and cousins with nurses. That is very, very similar, and so I completely understand that. Don't hold it against you. It's fine.
You're all good.
But to be fair, on the flip side of that, I think that because of the girls just rubbing along and knowing what I'm like, I think it just enables me to be a bit more empathic at work. I'll be honest, I do talk about my family quite a bit at work, especially like with the patients, if they're interactive. Have you got family? Because you just chit chat, so they want to show pictures. So I'm a proud mum at work. Very proud mum. And I actually, through your alopecia journey, obviously going back to the circumstances that I work in, some of the men, some of the women, they've had hair buzzed off because it's like brain injury, brain trauma, tumours. We get all kinds for needs for brain surgery, but just dealing with that change in image. And we get quite a lot of women. A few men have mentioned about the hair loss, but they just want to just buzz the lot, start again usually. Well, most do. And then some really aren't bothered. But it's like some of the ladies, it's like, oh, what can I do? But they are quite good in like just buzzing the minimal off. They do take those wishes into consideration as well. Sometimes, if it's possible, they will, but sometimes it's not always possible. But the women are like, I'm going to wear a wig. I'm like, I know the person. Just look at them.
She's right. There you go.
She's in a wig there. She's not in a wig there. She's in a wig there. She's not in a wig there.
That is so sweet.
Yeah.
I like that. That's really cute as well.
And I think it just gives the patient that, like, I can go out looking like half a buzzed head and, just embrace it. Or even just a headscarf look as well.
Yeah.
I know as a child, you never wanted to with a headscarf because, again, it came with illness.
The label as growing up, that's the perception I had at the time. But I think by doing that, it gives obviously your patients a different perspective for after, and almost something to look forward to trial and, try new things. I guess it gives them a different way of thinking about it all.
What should the world know about the NHS?
Oh my God, we haven't got that enough time. Yeah, I think everyone's experience with the NHS, you'll always get bad, you'll always get good, but it's the individual experience. And I think everyone's journey is their own, be it good or bad. But I think that's probably makes them a bit more resilient to what they're dealing with at the time as well. And I think if the services are there to be tapped into, I think so long as those services are put in place early for whoever needs them, be it psychological, mental health, physical, the physio, the ongoing rehab side of it, to the support groups, I think a patient has to take ownership for their own recovery phase as well, and their own wellness and well-being.
So, as you know, we've been here before, we like to ask all of our guests any advice they would have. But in particular, for today's episode, I would love to know any advice that you would have to anyone who is maybe at the start of their journey or haven't even started their journey within being in the medical profession and potentially a nurse. So if you had any advice, words of wisdom to them.
Oh my word, don't do it. No. No. Joking aside, advice for someone up and coming. I think everybody's path in life, be it whether they want to do the medical, the surgical, or whatever role they want within the health care profession. You can't just say the NHS now because there's so many privatised roles that are available. I think you've got to take ownership for it. You've got to work and strive to be the best person that you can be, to be good at your job and enjoy it. Because time flies, and you'll be retired before you know it. Oh no.
Counting down the days.
Counting down.
Years. But I think I think if they've just got to follow the heart for a job in the care profession. I think they'll know.
They'll know.
Yeah. And on that note,
thank you.
Thank you so much for joining us today. It's been great to have you.
We've learned so much.
We really have.
Yes. And I think it's big insight into that world.
Whole different world that we're not necessarily, I mean, we are part of as people with disabilities and differences, but we're not really part of, if that makes sense. So it's
a
good
different
to know.
view of it all. So so thank you for being here today, Angela, and thank you everyone for listening and watching today.
We can't wait to have you sit with us next Wednesday.
Bye.